When she was 6 years old, Nina Mago was diagnosed with epilepsy. Her memories of the years after are painful.
Epilepsy is such a stigmatized condition and is so characterized by a heavy sense of loneliness. When a person has seizures and the community does not embrace them, then they start to get emotionally burdened to the level that some will take their own lives.
According to the World Health Organization, epilepsy is a chronic non-communicable disease of the brain that affects people of all ages. Around 50 million people worldwide have epilepsy, making it one of the most common neurological diseases globally. Nearly 80% of people with epilepsy live in low and middle-income countries. It is estimated that up to 70% of people living with epilepsy could live seizure-free if properly diagnosed and treated. The risk of premature death in people with epilepsy is up to 3 times higher than for the general population. 3/4 of people with epilepsy living in low-income countries do not get the treatment they need. In many parts of the world, people with epilepsy and their families suffer from stigma and discrimination. Nina was lucky. She was able to receive the right treatment at the onset.
I can tell you now that I have this condition, but I go swimming and I can drive, which is not the case for many other people. All these things are only made possible for you if you get the right medication.
For many Ugandans living with epilepsy, access to proper treatment is rare because the drugs for epilepsy are not readily available.
The medication is not enough, dear Minister of Health. It is not enough. This term is highly stigmatized due to its association with a curse and blame directed towards the affected individual.
And because of the myths surrounding it, ignorance and the stigma, many of those struggling with epilepsy seek for alternative medication.
Most of the patients seek care first from the traditional healers before Western medication. Traditional healers use a variety of management techniques based on the perceived cause.
The Ministry of Health now wants to regulate the activities of traditional healers.
So we are not ready to work with them as they are now. We need to do some bit of regulation and we need to agree on certain things. We need to have some MoUs with some of them in order to work with them properly. The users, they tend to have answers which are not right for the people suffering with mental illnesses.
In the meantime, there are efforts being made to make available affordable epilepsy drugs.
We have ensured that medicines are as low as the health center too. Those small dispensaries that you see in the health facility, in your communities, those are health center tools.
Today is the first time Uganda has joined the rest of the world to mark the International Epilepsy Day. Joyce Nakato.